Everyone, thank you so much for being here. And to our valued water customers, especially the populations impacted by the water advisory in the city of West Palm Beach, town of Palm Beach, and South Palm Beach, I thank you for your patience these past 36 hours. Believe me, I understand your frustration and your concern. This morning, the water advisory for vulnerable populations in West Palm Beach, town of Palm Beach, and town of South Palm Beach remains in effect until further notice. According to Environmental Protection Agency guidelines, the following populations should not drink the tap water because they may be vulnerable to the effects of the algae bloom-related toxin that we detected in our water system. Those vulnerable populations include infants, young children under the age of 6, pregnant women and nursing mothers, those with pre-existing liver conditions, those receiving dialysis treatment, and as a precautionary measure, the elderly and other sensitive populations. To reiterate, the advisory is for these populations only, and they should not drink City of West Palm Beach tap water. Though these populations should continue to follow the instructions contained in the advisory issued Friday night, which is published on our website, WPB.org, until the advisory is lifted. Our expectation is that we will be able to lift the advisory later this week. Now, as for anyone not listed in the advisory, you may continue to use city tap water to drink, cook, and bathe. To connect impacted water customers with water, the city has established 3 distribution points where the specific populations listed in the advisory may pick up a supply of water. Today, these points are located at Gaines Park, 1501 North Australian Avenue, and it is open between the hours of 10 a.m. and 1 p.m. Phipps Park, located at 4715 South Dixie Highway. Again, their hours of distribution will be 10 a.m. to 1 p.m. And Coleman Park at 1116 21st Street from 11 a.m. to 2 p.m. On Monday, Memorial Day, the Gaines Park distribution site only will be open between the hours of 10 and 1. Let me repeat that. Tomorrow, only Gaines Park will be open between the hours of 10 and 1. If we identify a need to open even more distribution sites today or in the future, we absolutely will do that. So how do we get here? Each and every day, we are testing our water system, from the canals going into Grassy Waters Preserve, to the city's water catchment areas, to the water treatment plant. In fact, this is an area where the city of West Palm Beach has been proactive, as we regularly test for toxins not even regulated by the Environmental Protection Agency out of an abundance of caution. Among those unregulated toxins for which we regularly test is the cylindral spore mopsin cyanotoxin, for which we test monthly, and we have done so since 2016. In fact, on May 3rd of this year, the test for this cyanotoxin came back clean. And we weren't scheduled to take the next test until June. However, because of some actions we were taking, some proactive actions we were taking, we did another test on May 17th. I will let Director of Public Utilities Poonam Kalkat tell you what they were doing, but again, had we not been planning to take some of these other actions, we would not have even tested again on the 17th. And for the first time on May 17th, we got a high reading and test of both our raw water and the drinking water leaving the plant. And we got the results of those tests on May 19th. So we wanted to make sure that the May 17th test was not an anomaly. So we tested 3 more times. So those 3 additional test results came back high. At that point, we contacted the Florida Department of Health and worked with them to issue an advisory to the public on Friday. We reached out to our 2 largest water customers, the town of Palm Beach and the town of South Palm Beach, to inform them an advisory would be forthcoming, and we reached out to them on Friday as well. Now, we were not able to release an advisory to the public without the review and approval of the Florida Department of Health. We did not receive this approval until late Friday night, moments before informing the public. Again, we had not seen this before in all the testing we had done since 2016. And to our knowledge, nor is any other surface water plant in the state, as it is an unregulated contaminant that does not have a defined EPA rule. I am told that the algal toxin is a result of environmental conditions and that there was nothing the Public Utilities Department could have done to have prevented its development. Now, I'm aware of the concerns expressed that the city should have informed the public sooner. We stand by our decision to test to confirm the initial high test results, those supplemental confirmation tests. And we could not tell the public until we received guidance from the Florida Department of Health. It didn't make sense to us until we knew from the regulatory agencies, including the Environmental Protection Agency, exactly what needed to be said in the advisory, who was affected, and how the public should respond. Now, in just a few minutes, Dr. Poonam Kalkat, the city's public utilities director, will speak more about the algal toxin, what it means, and to whom. She will also share with you the specific timeline as to what was known to the city, when the city knew it, and when and how it was shared with the public. All right, so what's being done to return our system to normal? The city has been working 24/7 around the clock to address this concern and lower the algal levels in our water system with the hope of lifting this advisory as soon as we possibly can. In fact, we have established processes at the water treatment plant and in the distribution system to treat the algal toxin. Now, we took mitigation steps right away, beginning on May 19th, when we got the results of that first eye test, by instituting a powder-activated carbon process, otherwise known as PAC, and then we also increased the chlorine in the treatment plant and free chlorination in the distribution system. The city has also introduced groundwater from the eastern well field and western well fields to help reduce levels of algae in the system. As we shared yesterday, because of the free chlorination, City of West Palm Beach water customers might notice a slight chlorine taste or odor in their tap water for the next few days. These temporary conditions will not cause adverse health effects. The free chlorination system is not novel or new to the City of West Palm Beach water system. In fact, it's a treatment we use at least once a year to disinfect the system, and we communicate usage of this treatment to our customers annually. If you are sensitive to the taste or odor of chlorine, keep an open container of drinking water in your refrigerator for a few hours to allow the chlorine to dissipate. Users of home dialysis machines, owners of tropical fish, and managers of stores and restaurants with fish and shellfish holding tanks are advised to seek professional advice, as a method for removing chlorine residuals differs from removing chloramine residuals from tap water. Now, in closing, I just wanted to remind everyone that this advisory is for only the populations detailed in the advisory, and that anybody not listed in the advisory may continue to use city tap water to drink, cook, and bathe. The process of returning our systems to normal is going to take some time, and I thank those in advance for their patience. As I stated earlier, we hope to be able to lift the advisory for vulnerable populations by the end of the week. In the meantime, we are committed to providing the public with daily updates. We understand this is a concern of the public. We are on this 24/7 because we understand the continuing threat of algal blooms to drinking water in Florida and the importance of the public having clean, safe, reliable water. With that, let me introduce Dr. Poonam Kalkat, who again is here to share what West Palm Beach water customers need to know now. Poonam?
Thank you, Mayor. My name is Poonam Kalkat. I am the Public Utilities Director for the City of West Palm Beach. And first of all, I'd like to thank everyone, and especially our customers. And I understand and share their concerns regarding the drinking water advisory. I do want to reiterate to our customers that the city takes this advisory and any water quality concerns very seriously, and the city works, like the mayor said, 24/7 to put preventive measures, monitor, assess, and treat or address any issues that come up. As the mayor stated earlier, this is uncharted territory for not just the city, but also for the state. The city proactively has been monitoring the source water and finished water for algal toxins since 2012. And in 2016, we also started measuring cylindrospermopsin as we saw it as an emerging contaminant. So it was not required, but because it was an emerging contaminant, we decided we would like to proactively start monitoring this. And we have a monitoring program in place which we sample on a monthly basis. The city also has used powdered activated carbon, PAC, to treat algal toxins for years. Additionally, biological filters containing granular activated carbon at the water treatment plant are also an effective treatment for taking these contaminants out. In fact, the city just finished building powdered activated carbon basin, a construction project of over $3 million to remove such contaminants from the raw water so the finished water would be safe for drinking. Getting back to the timeline, as the mayor and I mentioned, we sample for these algal toxins on a monthly basis. And in the past year, we have seen very high levels of algal toxins coming into the plant, but they were removed through the treatment process. Our monthly sample taken on May 3rd showed algal toxin levels in finished water to be much lower than anything that would cause concern. As the plant was getting ready to certify the PAC basin construction, we wanted to do a 7-day test for the PAC basin to look at the dosing and the contact time that would take for removing these contaminants. And just to reiterate that if we were doing monthly samples, our next monthly sample would have been in beginning June, early June. So this was an extra test that we were doing, and we wanted to do this as a baseline test. So on 17th May, we sampled for these toxins, sent it out to an outside lab, and received results on May 19th. And I want to make a correction. Our advisory said May 20th. We actually received, the city lab received the results on May 19th. We are working with Department of Health to see what we need to do to having that change in the advisory dates. Seeing the high results actually raised immediate concerns, but we had already started dosing on May 19th. Even before we received the results, we had started dosing the PAC. And we wanted to confirm that these high results were not an anomaly because we had not seen this before. Nobody else in the state has seen this before. And we also wanted to see the effectiveness of PAC dosing. So for confirmation on the high toxin levels, and as the external lab requires sample receipts by Thursday, we sampled on 24th, 25th, and 26th, 3 consecutive days, and received our results on the 27th. We reached out and started discussing with Department of Health on the 28th morning, and by 28th evening, as the mayor stated, we put out an advisory based on approval, language, and all the other guidance that we needed from Department of Health and Florida Department of Environmental Protection. As I've mentioned before, the city staff not only monitors daily, weekly, all the conveyance canals, the Clear Lake, Lake Mangonia, the watershed, for any kind of contaminants that could enter our system, but also for algae specifically. As the days get longer in the summer and as more daylight comes in and the heat goes up, there is a lot of potential for algal blooms to happen. And these are unpredictable. You can test, you can check and monitor an area today and tomorrow and see nothing that shows that there could be an algal bloom, and tomorrow you could get it. So, so we have been monitoring even upstream of where our water system starts. So Elliott Canal, where the city gets water from Lake Okeechobee, we check that too on a routine basis. And since over a month, we haven't been taking any water from the Elliott Canal because there were algal concerns and there were algae growing in Elliott as well as Lake Okeechobee. And because we were not taking any water and there hasn't been much rain, we actually have started seeing a drop in our system levels. So our lakes are lower and Grassy Waters Preserve is lower. And why should that matter? The reason it matters is because as these water bodies get lower, the submerged plantings and other plants and other vascular structures, they start getting exposed. And that will cause more chances of algae to build up and to grow. So that's why the water levels matter. So we are working very closely with South Florida Water Management District, and we have been asking them to allow us to start bringing our groundwater and blending it with the surface water earlier in the season, instead of waiting so much later in the season when we get into a much lower levels in our lakes. And we've been asking to do that for the eastern well field, and we will also ask them to do that for the western well field. So that'll be something that we are going to be working on. I think those are main points that I wanted to make. The city has already started bringing water in from the eastern well field and western well field. As the mayor stated, we are also increased the dose of PAC in the treatment plant process, as well as adding chlorine after our filters. We have also started free chlorination since yesterday, and all of those measures will help with knocking this algal toxin down. I've had conversations with Department of Health as well as, and staff is talking to them, as well as DEP. We've asked them for any other suggestions or any other measures that they want us to take, and at this time they haven't asked us to do anything more. We will be sampling on a daily basis to look for this toxin in the next few days, and once we get the results, we will make a determination after our consultation and guidance and approval from Department of Health to lift any advisories, and we will probably continue sampling on a weekly basis after that, just because we have seen this come up. That's all I had, and I'm sure the mayor and I can take questions.
Thank you, Poonam, very much for that very detailed report, and now we will take any questions that you might have.
Did anyone get sick from this so far?
To my knowledge, no. Are you aware of anyone having gotten sick?
We have received phone calls of people saying that I'm not sure what's happening, but I don't know the details. And I think we will work through our claim risk office and based on if anybody has any claims on anything. But I haven't specifically heard of anybody.
Can you talk about the toxicity levels that are harmful and where they've been testing in the water?
So EPA guidelines, like the mayor initially said, this is a little bit of an uncharted territory for us and other people in the state. The EPA guideline for this unregulated contaminant is 0.7 ppb, and the highest results we saw in the last few days were 1.5 ppb, and at that level, it's the vulnerable population that needs to take care.
Considering the criticism that you're getting from across the lake, would you do something differently if this happened again?
Probably not. And you know, everyone can play Monday morning quarterback, and it's interesting that we have been receiving those criticisms. You know, folks said, well, we should have let us know sooner. Even if we had let people know that we were receiving test results that high, it only would have begged the question, what do we do now? Well, the answer to that question is what comes out of the advisory, which we did not receive until Friday from the Department of Health. We didn't know, you don't know from the test results which populations are vulnerable. You don't know from the test results whether you should boil water or not boil water. All of the information, the guidance, comes from the Department of Health, and it has to be blessed by them. They have the data which says, you know, who is vulnerable with levels of this high. So to suggest that something would have been accomplished by revealing on May 19th or May 20th that we have these test results, that only would have, then they would have said, okay, what do we do now? And the answer to what do we do now is what comes out of the advisory from the Department of Health. And what I will also say to the elected officials across the lake is, they know how to reach me. And if you have any questions about what we are doing or how we are conducting our business with respect to the water, I am happy to talk about it and get staff to discuss it with you. My door's open, my email is available, my phone number is available. Please reach out to me if you have any concerns or questions about how we're doing business with our water over here. I'm very proud of my staff. I think they have taken the action that was appropriate under the situation and under the circumstances. And so the short answer to your question is no, I would not have done anything differently.
How many total customers do you think you have? You know?
Total in the whole system?
Yes.
Around 120,000, including town of Palm Beach and South Palm Beach.
Thank you.
Some people have been emailing and saying, oh, you know, I felt sick yesterday morning, I drank coffee made before I got the alert. How much would you have to ingest before it could be harmful, do you think?
I'm not very sure about that. That would be something that Department of Environmental Protection is actually working with us. We are working with the Department of Health and Department of Environmental Protection to hopefully provide guidance for any other surface water plants in the state, and as to how to, if something like this comes up, what needs to be done, how it needs to be done. From things that I have read through EPA guidance, it actually gives you a 10-day advisory guidance, which the way we are looking at it means that you have 10 days to advise people if you see something. So, and I'm not an expert on this particular algal toxin, so I can't really speak to that, but there are toxicologists in Department of Environmental Protection who are looking at this, and they will provide us guidance. I had a conversation with some of the staff there yesterday, and they are working with us to provide guidance for future for everyone. And I think there are 12 surface water plants in the state, and none of those plants we have never seen something like this.
I think it's also important to know that this is not a regulated toxin. All right, this is not on the list of toxins that the EPA issues. The city was being proactive by testing for this. We got a clean test on May 3rd, and only 2 weeks later, when we were testing for different purposes, did this information come up. So if it was perceived as a dire threat to the health of consumers, I'm sure it would have made the EPA's top 10 list or top 12 or whatever. This didn't even make that list. And out of an abundance of caution, we started testing for this back in 2016. And this is the first time it's ever reached these levels. And we are taking all appropriate mitigation efforts to limit it as soon as possible. Anything else?
I had a question, just on the Lake Okeechobee thing. I'm born and raised in Jupiter, so I'm used to like the whole Lake Okeechobee thing and all that. But I'm not sure if the technology exists, or are there any preventative measures to try to help kind of alert if some type of algae is kind of like forming or coming through the pipeline? Is there anything, I don't know if you guys had a plan like in talks to, try to prevent something like this, like if possible?
So we have a very robust monitoring program in place. We look for anything that can be considered a precursor for that might say that an algal bloom can happen or algae can be growing. Some of those things can be like chlorophyll A. We look at pH. We look at temperatures. So we look at all of these things on a regular basis, daily basis. The reason we haven't taken any water from L8 and Lake Okeechobee since April 26th is because they were seeing algal levels, and we did not want to bring them into our system. But we have a system of canals, conveyance canals, as well as lakes. These are surface water bodies. And in South Florida, in the summer, there is a likelihood of getting an algal bloom. And again, we have staff monitoring on a regular basis. They are able to usually treat it, isolate it, and you have to be careful when you're treating it. You're not releasing any toxins either. So we isolate it, and that's how we do it. And we have continued to do that. So Anything proactive you can do, we are already working on that. We are talking to South Florida Water Management District to see what they are doing. We are also talking to Army Corps about some of the lake schedules of how the releases work and how they don't, and making sure that all of those things are being balanced.
And for people to just understand the public utility system or the water, I'm not sure if you all have like a map of just, what's covered in anything. Is your public utility website, is that the best way people can go to just kind of educate themselves about the system, what you guys test and everything?
I will check what we have on our, we check for a lot of things. We don't have all of those things on there. We do have a consumer confidence report which just shows the things that are required by EPA for every water system to basically report out. We do much more than those things on a regular basis. I will look whether we have a map on the website or not, but we'll put something on.
And we could get that information and make that available to the public. Again, as Dr. Kalkat said, we go above and beyond. We test for far more than what we're required to test for, including this current situation.
How much do you test for? I'm sorry. How many toxins do you test for?
The toxins are two of those, I think, right now, microcystin and cylindrospermopsin. But we are looking at anything else that we should be testing for, and we will as needed.
I know a few local businesses, they weren't serving people, so is there anything else that you could tell some of these businesses out there about what's going on, as in working wise?
Well, they have to make their own judgment as to who they should serve and should not serve. We stand by what's in the advisory. That's the information we've gotten, that there are only certain populations which are vulnerable. And if the business feels that means they shouldn't serve anyone, I can't make that decision for them. The advisory is very clear as to who should not consume tap water. And we stand by that. That's the best information we've received. How the private businesses and private sector interprets that is up to them. We are making water available to members of those vulnerable population groups at the different distribution sites, and we'll continue to do that as necessary. Anything else? Well, again, thank you all for being here. Thank you for helping us get the word out. We appreciate it.
Thank you very much.